Mr. Space?
Thank you, Mr. Chairman. I have an amendment at the desk.
Without objection, the amendment will be considered as read. The gentleman is recognized for 2 minutes.
Thank you, Mr. Chairman. I'm offering this amendment with the intent to withdraw. The amendment is being offered because of concerns that the provision in this legislation creating a medical device registry may be unnecessary. While I join all of my colleagues on both sides of the aisle in supporting ways to reduce costs and enhance quality of health care, I fear this new registry will not accomplish the desired goal. In particular, I worry that many of the duties of the registry would be redundant with responsibilities of the FDA. The FDA is already implementing its Sentinel initiative that will allow the agency to pull data from existing registries to help understand medical device performance and patient safety issues. In light of those potential redundancies, creating a large new registry may therefore not be productive. A comparable registry implemented by the American Academy of Orthopedic Surgeons yielded a net cost of $25 million per year. Again, Mr. Chairman, because this provision is a new one, I believe that further discussion is merited before we sign it into law. Given your indication to work with us on this issue, I offer my...
the gentleman yield.
Of course.
In Indiana, we have many medical device manufacturers, and if you're going to work with the chairman, I would like to be included in that.
By all means.
I yield back.
And would the gentleman yield?
Would the gentleman yield?
Yes.
Yes. Thank you to my colleague. I don't think it's my understanding that first of all, the gentleman raises, I think, some very important points, and I'd like to add one to them. And I don't believe that the FDA has been consulted on this issue. I think the FDA needs to be brought into it. As I understand the amendment, it would, well, I think it's extraordinarily complicated, and we need to ferret through this very carefully. It's an important area, so I thank you for yielding to me, and I look forward to being part of the team that will work on this. Thank you.
Mr. Space, I'll look forward to working with you and all of our colleagues that have an interest in this very issue. Do we need more discussion?
No, I want to weigh in for about 30 seconds, Mr. Chairman.
Go ahead.
Just to say the FDA is already doing a Sentinel initiative. CMS already doing some stuff. Agency on Healthcare Research Quality is doing stuff. The American Academy of Orthopedic Surgeons already doing stuff. So I think you'll find a lot of support against duplication unnecessarily. So I'd like to join my colleague, Mr. Space, in this amendment also.
Thank you very much. Mr. Space, you withdraw your amendment?
I do, Mr. Chairman. Thank you.
We now go to the Republican side. Is there an amendment on the Republican side? Joe? Mr. Burgess?
Well, Mr. Chairman, I would like to be recognized for the purposes of asking the chairman to engage in a colloquy.
Gentleman's recognized.
Well, thank you, Mr. Chairman. And as you well know, and we've had this discussion before, the work that's gone on in this committee trying to ensure having a future physician workforce to care for America's patients. Mr. Green and I passed H.R. 914 out of this committee earlier this year, and in fact last year we got it passed on the floor of the House only to die in the Senate. My intention is to offer this bill as an amendment. The underlying bill makes good investments in the country's physician workforce. It's my understanding that, or at least I've been told that the committee is willing to work with me to further this important aspect of the broader health care reform, and that our staff can continue to work to find ways to ensure that this provision can be modified to become part of the existing package. And I would just simply ask if I'm correct in assuming that I have the chairman's commitment on that.
If the gentleman would yield, yes, you are. You are accurate. I want to thank the gentleman for this idea. Providing more incentives to start residency programs is an idea we took very seriously when designing our workforce program. Some of this policy is very similar to sections of the America's Affordable Health Choices Act. Section 2214 of our bill directs grants for the purposes of initiating a new primary care residency program in outpatient centers and for supporting such programs. I think there's some good ideas here, and I want to see if we can work together on them and see if we can put them in the legislation.
I thank the chairman.